Hi there, are we live on Periscope? Okay, as promised, this Tuesday, July 26th, is it July 26th now? July 26th, we are talking about Botox and the 12 cosmetic uses for Botox. I think there's even more than that, but I'm going to give out some other cosmetic uses that we use. Botox for cosmetic purposes is FDA approved for only 2 spots. They recently got approval about a year ago, I believe, for the crow's feet. And before that, they've always had indications for the frown lines. So I'm going to talk about some stuff that's off-label use. When you hear off-label, it sounds bad. It just means that the company didn't put in the 5 years of research that it takes to get the FDA to clear it for other indications. A lot of doctors will do other areas that it's safe to do. Just because it's not indicated by the FDA, it's not approved by the FDA, does not mean that it's not a safe area. So the other areas that I'm going to talk to you about today are the forehead, and we have a lovely patient here today who's willing to be our demonstration patient, so you guys out there who are watching can see how that injection is being done. So we do for the forehead, which is not an FDA approved area. Other area I told you already is the crow's feet and the frown lines. The frown lines are a popular area. And then the bunny lines that can actually show up from people who are just squinting, or when they laugh, they've got these lines that show up right above the nose here. Those are the bunny lines. Another area is actually gummy smile, a gummy smile. I don't know if some people out there have that, but it's when you smile and you got a lot of your gums showing. And so it's not just all your teeth, but the gums when you smile. So that's an indication for the Botox. It's really specific how we do that injection. So we might do that as a demo down the line, but it's a very specific area. Another area are the lip lines, or people call the smoker's lines. So that's something that we can smooth those lip lines out, and that takes just a couple of units of Botox that's needed to get that smoother. One other indication around the mouth area is the chin. So people will get the chin dimpling. As you get older, we can get some chin dimpling. I see that a lot in my practice. People want to do fillers for that, and I actually provide that option with the Botox that they did not know about. And actually, it's an easy thing to do. A couple units, 10 units every 2 to 3 months, and that will solve it. Another area is actually the tip of the nose. So instead of doing a rhinoplasty, if your tip is drooping and it's due to the muscles bringing it down when you smile, when you talk, there's an injection we can do with Botox to lift the tip up. I know that sounds cool, huh? All right. I do love doing non-surgical rhinoplasties, and that's one cool thing that we can do using Botox instead of fillers. And then one other area that happens a lot as we age is the corner of our mouth starts to droop down, and we seem to look sad when we might be happy, really. And that lip curling down is related to a muscle that's right here. It's called our depressor anguli oris. I know that's a long term, but it's a muscle that we can inject with Botox and turn that frown upside down. Okay? And then a lot of people have heard about what's called a Nefertiti neck lift. So this is a non-surgical neck lift that can be performed using Botox. I know, it sounds crazy, right? So what do? Well, we do a couple of tiny injections along the jawline, and in the neck we can get some what we call platysmal bands or neck banding that would show signs of our age. And we can inject each of these muscles, and that tightens up the neck. So that's without surgery. So that's for those people out there that are looking for a non-surgical option for their neck. That's one to look into. I think, have we gone down to 12? Have gone to 12 yet? All right. One other area I think I haven't mentioned yet is the jaws and the jawline here. So some people have a very wide-angled jaw. I sort of have that, but I don't think that I'm going to go to the process of having somebody inject me yet. So the wide jaw is very popular to take care of in the Asian population because we get a wider face down below, and this can be molded by injecting the masseter muscles here, which then makes the bone line slimmer. And so that's for people who have a wide jaw. We talked about the gummy smile, smoker's lines. The last indication, I think we did this a couple weeks ago, is we did a chemical brow lift, and that's just to raise the brows as they start to descend as we age. And I already demonstrated that last time. I hope you guys were able to watch that, the before and after photos we added just recently, so you could see what that looked like before and after the injection, maybe a week or two after the injection. So, well, without further ado, we're going to do a demonstration today of the forehead area. And so I'm going to talk about her forehead. So you're going to come in closer so I can show you what we're addressing. Can you go ahead and raise your brows for us for the cameras? Okay, so these lines, anybody out there who gets these forehead lines and don't like it, want that smooth forehead, kind of look at my forehead. I do my injections.
That's what I want.
So how do we get that smooth appearance? Well, there's an injection that we can do with the Botox to just basically fade those lines and smooth out the forehead. It will look like a tighter feeling to the forehead. For those who don't know, for the first time, if you had the injection for the first time, you may describe, some people will describe, I had that the first time I had it injected, was a headache, a slight headache. So that's common to know. Also, some other things to know about Botox is you don't want to lie down for the next 4 hours after the injection, which you won't be doing, right? And you don't want to be active, so no going to the gym right after the injection. So you want to plan your day, do your exercise before you come in for the injection with your doctor, okay? So for the injection points, I like to see how the patient's moving their forehead. Go ahead and raise your brows. She's got some nice arch to her brows, but she's got these lines just right above the brow. Now we don't want to over inject in this area, otherwise the brows will drop and then they'll feel heavy. So it's a tiny injection right there. I don't like to overdo it, but her main lines are up higher. So we stay up high. She has a small forehead. Okay, so beating from the hairline to the brow area is a small area. And we like to stay at least, I like to stay at least about an inch above the brows without dropping them. If you go below that, then you could potentially drop brows if you put too many units. And Botox has a tendency to not spread as much as some of the other toxins out there. So when I'm using Xeomin or Dysport, I might be more cautious. But with Botox, we can get a little bit closer to the brows and so take care of that line. All right, so I'm going to drop the Botox over here. You can still keep the frame over there. We have our board back here, which has our list of social media sites. And if you could just move a little bit, Shanice, so they could see that. We have our Periscope, our website, our Facebook account. Most of these are at Faces by DRT. Our only one that's not is YouTube, which is at Faces by DRT 1. I don't know if maybe the Faces by DRT got used or something like that. Probably I set up the account and messed up. All right. Oh, I'm so strong. And then expect that this will kick in about 3 to 5 days, sometimes sooner. Maybe the first time it takes a little bit longer, but then each time after, it may be much quicker. Like for me, it takes probably a day or two, and you can start to see it already. Okay. So for you, I'm going to start off at 10 units, and you can always add more. Okay. Don't want to overdo it, the forehead. The frown lines, sometimes I go over if we need to, because nobody wants frown lines. But forehead, we don't want the eyebrows to droop. So that's a part that I have to be careful about. Okay. We have such a beautiful model here with us today. Do you want to tell people your age?
I'm 27.
Okay. Yeah. So people ask me, how early could you start? As early as you want, really. If you're starting to see any lines and you want to prevent them. This is a preventative treatment. I do as early as 20. So that's something that You can, if you're thinking, oh my God, people are telling me it's too early to get started. It's not. It's prevention. I think I started too late, to be honest with you. I'll tell you, I started in my 30s. And that was when I was starting to notice some lines on my forehead. That's what bothered me first. It wasn't even the frown lines. All right. So I'm just icing before I start. Okay, and then I've mapped out, I'm not going to mark her forehead because, you know, that would be using all these markers, but I like to just see how she's moving. So raise your brows again. Okay, so up here is, a lot of the lines are up here, okay? So we're going to stay up high. Okay, relax. Okay, so I'm staying up high. Here's the first poke. Great. Here's the next injection. Sorry. Okay. Usually I do this sitting down a little bit, so I've got better control, but we're doing it this way for the cameras here today. Okay. So I've gone up above here, a couple spots. Little spot, just a little loose. Raise your brows again. Okay. Okay, now I'm going to come across in the center. Okay, relax. And then I do a little drop right above the brow. So raise your brows again. Okay, relax. Just a tad. This is usually a little low for some other ones. This is just one drop. I need one more, so I'm going to add a little bit on that side. Okay. Let's drop it there. I'm going to come along this side because it's a little bit hard for me to inject all the way across over here. So raise your brows again. Okay. And how was that for you, Shane?
Not too bad.
Okay. Any pain? Minimal, huh?
Yeah,
you're used to this.
Yeah.
All right, and there you have it. That was the forehead. Very simple, a couple injections across the forehead. And really, each one is tailored based on how we move our brows, okay, and where the lines show up on our forehead. All right, that's it. Check us out on our YouTube, Facebook, Periscope, and Twitter and Instagram. And we'll have another video for you next Tuesday, and I'll have a preview this Thursday about our next topic. See you then next Tuesday at noon. Bye.